Hello everyone, it's Maxine Szramka, the rheumatology doctor. Today I'm going to talk to you about ankylosing spondylitis and how we treat it. Talked about how we diagnose it, but how do we treat it? Treatment is divided into two things. I always look at treating the symptoms and then treating the disease. The type of treatment that you need is going to depend on how severe your symptoms are. With ankylosing spondylitis, many people can have quite mild symptoms that are on and off, and it doesn't interfere in their lives too much. We start to look at treatment more significantly when your symptoms are ongoing and you're getting them most of the time, if not every day. You're super stiff, and particularly if it's impacting the way that you move and the way that you do your life. So in terms of symptom relief, we use anti-inflammatories. And you can try different anti-inflammatories and always be guided by your doctor in which ones you're trying, and try and find the ones that don't impact the body negatively. So you don't want ones that make you feel sick or give you high blood pressure. It's quite simple that way. The other thing that people can take is supplements, and some people want to try dietary changes to see if that makes a difference. I'm very open to people exploring dietary changes. However, there's no one arthritis diet, and those kind of things need to be done in conjunction with supervision by a nutritional expert to make sure you're still getting all the right nutrition in your diet. There's a lot on the internet about different diets. Some of my patients tell me that when they go on a low-starch diet or gluten-free diet, that it helps their symptoms. I certainly am not one to advocate eliminating everything from your diet straight away. By all means, explore diets and explore things that you see on the internet or that you hear from people that say helps them, but make it work for you. And my experience has always been to try things gradually and to cut things down rather than completely eliminate things, because the body can go into a shock after you eliminate things from the diet, and it can be quite a big change to the body. So my advice, if you're pursuing things, just do things gradually, bit by bit, and just see how it works for you. Don't have any expectations it's going to cure your disease, because it probably isn't. However, it may give you some greater sense of well-being, and some people do find it helps symptoms, so it's certainly worth pursuing. In terms of supplements, again, they don't cure the disease. Some of them may help with some of the symptoms like stiffness or pain. But again, my experience has shown me it's very individual, and there's certainly no published good data on the effect of supplements when it comes to ankylosing spondylitis. So be very judicious when you try things, and try it for a little while. And then if you don't notice an impact, then stop it. There's no point spending your money on something that you don't feel is benefiting you. Then we reach the stage that if you're having symptoms that are really severe, not responding to anti-inflammatories or exercise therapy, which is another important part of management, then we have drugs called the biologicals. The biologicals are what I call designer drugs for arthritis. They're grown in living cells, which is why they're called biologicals. These drugs are fantastic when it comes to relieving symptoms of ankylosing spondylitis. They're uber expensive, and not everyone needs them, so we don't put everyone on them, especially when your symptoms are mild. The biologicals don't stop the disease, they don't cure the disease, but I've seen great results in how they make people feel when they're on them, which is great to see. It's great to have medications that can give people a feeling of liberation and return them to function in their lives. I have quite a few patients that have quite serious deforming disease that came to me quite late for a diagnosis, and the biologicals still help them enormously in terms of improving their quality of life, even though the spine has still been quite a bit curved over, and it's always a joy to see them when they come and see me. Exercise is a really important part of managing your symptoms. I actually strongly recommend that everyone with a diagnosis see an exercise physiologist to get an overall assessment and to get a plan for how to stay fit, and also an appropriate stretching program as well, which is important for controlling symptoms. So that's the nuts and bolts of treating ankylosing spondylitis. It's quite simple. The most important thing is, if you have a diagnosis of ankylosing spondylitis, you have a regular treating rheumatologist, someone you have a great relationship with, and see them regularly to make sure you're getting the best possible treatment, and to make sure you don't need to upgrade your treatment to anything else new that might be available. Any questions? Please get in touch. Take care.